It is not behaving right, Minerva, so we'll see what happens.
Let's just go ahead.
All right. Well, sorry about all that. I appreciate your patience. As I said earlier, my name is Glenda Rogers, and I'm going to be your facilitator, hopefully, for today's session. Today, we're going to be talking about what you need to know about medications and the benefits and risks for seniors and caregivers. So before Lucy gets started, for those of you that don't know her, let me just introduce her, tell you a little bit about her. Lucy Barylak has a master's degree in social.
We can't hear you, Glenda. Wow.
It's going so well.
All right. So Minerva, what do you suggest we do?
Internet. Oh, Lord.
Linda, you're freezing every once in a while.
Yeah.
Well, I don't know what to tell you. Got it. Okay. All
We'll
right.
continue.
We'll continue. Okay. So
Okay. So I have a master's degree in social work. I've
she
been
does.
I've been doing research for many, many years on caregiving. I've adapted a lot of programs in caregiving. And on a personal level, I was a caregiver for my mother for over 10 years. So today I'm introducing the guide, which is, the name is Understanding Medication Safety, Taking Important Steps to Protect You and Your Loved One. And it's by the WellMed Charitable Foundation. It's free, and we're going to tell you how you can get that guide at the end of the program. What I do want to say, though, is it's an hour session. During the session, I will ask you if you have any questions. And at the same time, what I'm going to do after the hour is over, I'm going to stay on the line. We're going to close the recording. If anybody wants to ask me more personal questions, and if you want to take your name off or your face off so that you can have, that you could just talk as freely as you want to. So we're going to offer that at the end, and whoever stays, even if one of you stays, I will still stay on for the next half hour. As you hear, I'm having a bit of a problem talking, but I'm doing the best that I can. So let me tell you about the free guide. Most of the information that I'm sharing with you today regarding the safe use of medicine is in the guide. It's really a very good tool to have on hand. I also looked at an awful lot of research so that it sort of validates a lot of the things that I'll be talking about. So a lot of the questions that you may have or experience that you're having could be in the guide that corresponding to your answers. But remember, it's only a guide that will give you some answers as well as guidance to report any issues to the doctor or the pharmacist, no matter what. If you have concerns about anything about the medication, speak to your pharmacist or the doctor as soon as possible. Next slide, please. So what I'm going to focus on today is really what are medications and possible side effects. Usually when people think of medications, we think about prescription. Medications and the risk of falls for seniors, it's huge. Common mistakes when using medications. Pharmacists are your best friends. And examples from the guide. I want to tell you that modern medicine has contributed to larger lifespans, improved health, and better quality of life. Medications are the most common treatment for many diseases and conditions seen in older people and persons with disability. Medicine now not only treats and cures disease that were untreatable just a few years ago. They aid in the early diagnosis of disease, prevent life-threatening illnesses, relieve pain and suffering, and allow people with terminal illness to live more comfortably during their last days. However, for older adults and people with disabilities, medications, prescription, over-the-counter, social drugs such as alcohol, and herbal medication, alternative medication, can be a double-edged sword. when not used appropriately, effectively, and safely, medications can have devastating consequences. You know, the changes that occur with aging and disability make people more likely to suffer medication-related problems. We call them MRPs. Nevertheless, research has shown that medication-related problems are often preventable. Caregivers can play a key role in helping to identify when an actual or potential MRP is occurring. This assistance can help prevent the costly and unwanted negative consequences of medication use, such as admissions to acute care hospital, assistance living facilities, or nursing homes. About 1/4 of all nursing home admissions are due, at least in part, to the inability to take medications correctly. So I have to say, for me and others, this is really, really a wake-up call. I'm going to give you a little bit of statistics that are very up to date. You know, the safe and responsible use of medicine is important for everyone, but is a particular concern for seniors. American seniors take more medication than any other segment of the population. While seniors make up only 16% of the population, they receive between 28 and 40% of all medications prescriptions. That's huge. You know, some seniors take as much as 9 different pills per day. Because of the increase in the incidence of chronic or acute illness with age, older adults are more likely to suffer from conditions that need drug treatments. At the same time, the physiological changes that accompany aging increases senior sensitivity to medicine. It affects the way older adults absorb, metabolize, and eliminate the medications. I'm going to talk a little bit more about that because it's really important to understand that whole process. Many seniors are also taking several kinds of prescription and non-prescription medicine at the same time. As a result, they are more exposed to the risk of adverse reaction from unnecessary, inappropriate treatment and the misuse of medicine. One study showed that older adults had an average of 3 drug-related problems. In reality, caregivers may find themselves helping with administrating and or managing multiple drug therapies. They fill and pick up prescription, monitoring schedules. Caregivers often see the results of any side effects and must react accordingly by calling the doctor or the pharmacist. You know, prevention is the key factor when using any form of medication. You need to know all the risk factors that are involved. I want to tell you on a personal level, I was caring for my mother who had many, many medical problems and some form of cognitive impairment. And I came in one day and she was really totally out of it. Long story short, what she did is really one of her neighbors told her, I have this great medicine that I just got from my doctor, and it really relieves the pain. My mother took it, unfortunately landed up in the hospital. Things were okay later, but you know, these are things that I really want to talk about. So never, ever accept any pills from anybody, please. And don't give any of your pills to anyone as well. You know, medication mistakes cause at least 1 death every day in this country and injures approximately roughly 1.3 million every year, according to the US Food and Drug Administration. People aged 65 and older are especially vulnerable to medical errors for different reasons. So again, caregivers, you play a vital role in keeping seniors healthy by familiarizing yourself to the most common medication errors. I want to talk about a very recent study that was done according to the CDC, Center for Disease Control and Prevention. The report came out in November 2020. You will also be receiving all these slides plus the resources. So if you want to go into things more deeply, you can actually go in and read them yourself. What they're saying is that older adults, 65 years and older, visit emergency departments almost 450,000 times each year, more than twice as often as younger persons. Older adults are nearly 7 times more likely than younger persons to be hospitalized after an emergency visit. But most of these hospitalizations are due to just a few drugs that should be monitored carefully to prevent problems. So I'm going to give you a few of those, but there are a lot more. For example, if you're on a blood thinner, diabetic medication, seizure medications, opioids, painkillers, and these are just some examples of medications that really, really need to be handled very, very carefully. So what they're saying is that we need to keep in mind that medicine, either prescription or over the counter, has potential to improve health and well-being. Many people, including older adults, depend on medicine to provide relief, control their medical condition, and help them lead normal, active, or independent lives. But when not taken properly, it can sometimes cause the health-related problems to really, really escalate. So before I go any further, I'm just wondering if anybody has any questions or if you'd like me to explain a little bit more, but I'm going to cover everything that I'm saying on the topics. Somebody have any questions?
You can just unmute your microphone if you do, or put something in the chat box. Or if you've called in, I see we have one person that has called in. *6 on your phone will unmute it.
Okay, perfect. Okay, so let's talk about multiple medical conditions. So we know with a lot of seniors, it's not just one thing that's really going on. It could be high blood pressure, cholesterol, diabetes. It could be multiple things. So older adults often have multiple medical conditions. These may affect how medications work in the body. Medications used to treat one condition may also make another condition worse, okay? For example, older adults with memory problems may have worsening symptoms caused by the medicine used to treat their other conditions. Therefore, it's important that all providers who prescribe medication for you know about all of the medical conditions you have or the person you're caring for. Also, to be sure to let healthcare providers know if a medicine they gave you worsens any of your conditions. Now, there's been a new practice in pharmacies, and I hope that your pharmacists are doing that. Before, they never asked you if you're taking any over-the-counter medications or supplements. It's extremely important to let them know it's not just your prescription medication. The other thing to keep in mind is that medication may be affected by food, beverages, and supplements or medicine that you take at the same time. For example, some antibiotics are not absorbed well when taken with foods, beverages, or medicine that contain calcium, magnesium, or iron, such as antacids, vitamins, or dairy products. So, you know, when you get a prescription, usually you always look at the sheet, but that's very important to keep in mind to ask those questions. Like certain foods such as grapefruit juice can also change the metabolism of certain medications. This may cause the medicine to build up in the body. You can ask your pharmacist about what foods, beverages, or supplements to avoid when you pick up your medications. So you know that you always have a slip that gives you how to take the medication. Please read it and keep it with you as a reminder. Can we go to the next slide, please? Okay, so let's look at this. So what are medications? Types of medications, as I said, they're prescription drugs, over-the-counter medications. Keep in mind that a lot of us, sometimes you have a cold, whatever, you get over-the-counter medications, especially for pain. Maybe you are not sleeping well. Even natural products and herbals. Many times there's certain herbs that are supposedly good for you, and they may very well be, but you need to ask the pharmacist Are they okay with what you're taking, your prescription medication? The same goes for vitamins or organic products. And for all of you, I'm sure you know, but let's just review it. Medicine comes in tablets, capsules, pills, liquids, puffers, inhalers. Now, cream, sometimes, you have a joint pain, you put some cream, you might not even think about it. It does go into your bloodstream. Patches, drops, needles, suppositories, and ointments. Are there any questions about this particular issue? What are medications? If not, we can go to the next slide, please. I want to talk about side effects. Okay, we call them adverse reactions to drugs. That can be a symptom that develops due to taking the medication. So many times there is dizziness, which can cause falling. Mental confusion, I have to tell you, not even for people who do not have cognitive impairment. And for those who do, unfortunately, it can even be worse. Dehydration will also cause you to be confused. There could be diarrhea, constipation, even a rapid heartbeat. There's sweating, pain that was never there before. For example, one medication in particular for cholesterol does give certain people some pains in their joints. So it's important to know that and ask the doctor, because maybe they could switch it around. Now, there could be aggressive behavior from someone who, especially if they're cognitive impairment, but all of a sudden, person really gets angry. There's also a boost in the sex drive. So some side effects can go away, and it usually will tell you. Some are expected, and others are just found when you have to either have a blood test or a lab work. If you think someone is having a bad reaction, I'm talking a really bad reaction, or somewhat of a reaction, call the pharmacist. Worst case scenario, go to the hospital. So I'm not trying to rush this, but if somebody wants to ask me questions about side effects, now is a good time. Okay, so we will continue. So let me just review and tell you that certain medication can also, as I said, boost someone's sex drive or cause aggressive behavior, especially for someone suffering from any form of dementia. So please remember that if a loved one all of a sudden starts behaving inappropriately, sexually, or in any other way, it's time to call the doctor. All right? Explain to the doctor what is happening. I have to tell you, many caregivers tell me that they are embarrassed, especially when it's a sexual thing, to discuss this problem with anyone. So please keep in mind that the behavior may be caused by a certain medication or another physical problem that you're not aware of. The person could even have an infection, urinary tract infection, or there could be another medical issue that's going on, and the doctor needs to know. The doctor may want to prescribe some new medication to kind of calm the person down or reduce the medication they are on. So it's really, really important to be able to talk about that. Can we go to the next slide, please? So as I'm going through these slides, I do want to remind you that they are in the guide. And you will receive all these slides. And so that's important to kind of think about that. Now, I want to talk about medication, how it works differently in adults. So as we get older, our bodies react to drugs differently than when we were younger. The aging process can affect how the medication is absorbed in the body, and it takes longer to flush out of your body. Change that decreases your body's ability to break down or remove certain medications from your system may mean that the medication can stay in your body longer, all right? That's why it's so important to drink 8 glasses of water anyways, but especially when you're taking medications. I'm not a water drinker, So it's really difficult for me to drink water, but I will flavor it with lemon or mint, whatever it takes for me to get those at least 6 glasses a day. You know, some studies have shown that certain medications are less safe for older adults. And I really, really want to talk about this now. Can we go to the next slide, please? Okay, this is important. It's called the Beers criteria. The American Geriatric Society recommends the Beers criteria that list the medication that may not be safe for older adults. Now, when you get the slide, you're going to be able to go on the internet. There's at least maybe over 40 medications that really seniors should not be taking. The criteria can be used as a tool when talking to doctors and pharmacists about the safe use of medication for seniors. It was updated, I found out, in 2019. Now, some of the medications that are there, you need to take them for your condition, whatever it is, but they can change it around because it could be another brand or whatever. I know in my own history with my mother, I went on that, and certain medications that she was taking, I was able to negotiate more with the pharmacist than the doctor to kind of switch it around so that she wouldn't have the side effects that a lot of these medications have. So before we go any further, I just want to know if anyone has a question or a comment or some experience that you'd like to share. Glenda, are you with us still?
I am still with you. Taking some notes for myself.
Well, you don't have to. You'll get those. All right, so let's go to the next slide, please. Okay, following routine and finishing medications. This is so important. So even if a person feels better, it's important to finish all medicine or the sickness could occur again, especially antibiotics. From my own experience, as you know, I'm having some issues. I was on antibiotics, and I have to say, after 2 days, it was given to me for 5. After 2 days, I really felt really good. And if I didn't know any better, I would have said, you know what, I'm going to stop. I'll save them for next time. No. Because really what it means is that the infection is not gone yet. And what's going to happen is in a day or two, it's just going to start and be even worse. Some medicine must be taken at certain times in order to ensure the correct amount is in your body and that it works as long as possible. Okay, we're all human. If you forget for any reason, in the guide, it gives you a really good, the most important thing is if you forgot to give yourself a dose or the person you're caring for, call up the pharmacist and ask them. They'll let you know whether just skip it or take it as soon as possible. Always have a list of all your medications in your possession. And, I'm sure you all know that. One of the things that I think is important if you're a caregiver or a senior living on your own, put all your medications on the fridge somewhere that in case there is an emergency and you do call 911, they will see right away what medications you're on. And I carry a list with me wherever I go. I don't have that many, 2 medications, but it's still important to have them with you if something does happen. So before we switch to the next slide, I want to ask you a question. Where do you think is the safe place to store your medications at home? Come on, one of you knows that better. I want to hear from you before we go to the next slide.
It sounds like a trick question, Lucy.
Okay, we're having a little fun.
All right, you can just unmute your mic if you want to respond. Put something in the chat
I
box.
see someone there. Go on.
All right, go ahead, Darcy.
I keep mine by my bedside, and I know I should keep them in the cabinet maybe, but I keep them by my bedside, in the drawer. I keep them in my dresser drawer.
I'll let you know soon, but I think you're going to get an A+ for that one. Anybody else? Where do you keep your medications?
Well, I'm gonna be the one that says what you want me to say, Lucy. I keep it in the medicine cabinet in the bathroom.
I think you just gotta fail. All right, so let's go to the next slide and let's have a little giggle on that one. Do
Yeah.
not store medicine in the bathroom, even though we have a medicine cabinet, or the kitchen, because they can be affected by the dampness and the heat. Do not store medicine in any place that is too warm, like near a stove, heater, or in the sun. So if you're taking your medications with you on a beautiful day, hide them in your purse or wherever. The best place to store medicine is in a cool, dark, dry, and secure place, such as a bedroom. That's why you get an A+. Note that some medication obviously has to be kept in the refrigerator. Try to minimize the number of times that the bottles or vials are open to reduce exposure to moisture. You know, these weekly reminder boxes can really be helpful. Try to keep all medication together for convenience. Keep medicine away from children or from pets. So if there's any questions about that, or if you're wondering why I'm saying all this, I'd be happy to answer your questions. All right, so now we're getting down.
If I can just interrupt, Kim said, okay, I'm failing on this as they're in the bathroom. Okay, Kim, I'm not alone. I'm glad.
Very, very bad place to keep your medication. So get them out of there. I know sometimes it's more convenient. It's not as, I keep mine in the bedroom by the night table. It's not as convenient because you do have to bring a glass of water, whatever, but it's the best place to be. All right, so let's talk about drugs and risk of falls for seniors, because I've been talking about side effects, and side effects that make you dizzy can make you fall, right? So a study done in March 2021 by the University of Buffalo found that 94% of older adults prescribed drugs that raise the risk of falling. That's what I meant by the Beers criteria. So it's really important to check that one out. The study found that the percentage of adults 65 and older who were prescribed, a fall risk increasing drug-related climbed to 94% in 2017, and a significant leap from 57% in 1999. So the research also said that the rate of death caused by falls in older adults were more than doubled during the same period. So because seniors take more medication than younger population, as I said before, between 28 and 40% of all medications prescribed, they are more at risk for side effects. So when you get a new prescription, as I said, I'm going to keep repeating it. Please make sure to speak to the pharmacist or to the doctor about the fact, can these drugs really make you more dizzy or create a situation where you're going to fall? So please keep in mind that people who suffer from any form of dementia and are taking prescription medication or over-the-counter medication are at a higher level of risk for falling. So very quickly, I'm sure you're all aware what dementia is, but I just want to kind of go over it very quickly. It's a syndrome usually of a chronic and progressive nature. It doesn't stay the same, unfortunately, in which there is deterioration in cognitive functioning, ability to process thought. It affects the memory, their thinking, their orientation, the comprehension, calculation, learning capacity, language, and judgment. The impairment in cognitive functioning is commonly accompanied, and occasionally it proceeds by deterioration and emotional control and social behavior or even motivation. So keeping that in mind, what effects cognitive has on a person, so if they are displaying any signs of having side effects like dizziness, the changes that are that they don't have they don't have the cognitive ability to use good judgment in navigating in the home or even outside. As well, the medication side effects could have also increased their confusion and behavior. So for example, if they're really having a side effect and they're trying to get out of the chair, they might not have the judgment to realize, I'm too dizzy, I better not get up. And they get up. And the next thing is that they could possibly have a fall. I know it's a little bit out of the topic what I'm talking about, but it's so important to keep your house uncluttered. Little rugs all over the place or extension cords hanging out. So please look around, even for your own safety, to make sure that if you are on medication, you could have a side effect. And so it's really important to have an uncluttered home. All right, can we go to the next slide, please? So according to the U.S. Center for Disease Control and Prevention, more than 1 out of 4 Americans 65 falls each year. Falls are the leading cause of fatal and non-fatal injuries among older adults. And this was just done in March 13, 2023. And when you will receive the resources, if you want to read more about it, it's going to be there. So every second of every day, an older adult, 65 plus, suffers a fall in the US, making falls the leading cause of injury and injury death in this age group. 1 out of 4 adults will fall every year in the United States, making falls a public health concern, particularly among the aging population. So let me give you a few facts. I kind of condensed that whole research product. About 36 million falls are reported among older adults each year, resulting in more than 32,000 deaths. Each year, about 3 million older adults are treated in emergency departments for fall injury. 1 out of every 5 falls cause an injury, such as a broken bone or a head injury. Each year, at least 300,000 older people are hospitalized for hip fractures. More than 95% of hip fractures are caused by falling, usually falling sideways. Unfortunately, women fall more often than men and accounts for 3/4 of all hip fractures. So I know I'm saying a whole bunch of gloom and dooms, but these are realities for us. I'm also a senior, so we really have to be very cautious about falling, wearing proper shoes, making sure not to walk around with socks in the house that don't have those little things and you can slide and fall. Proper shoes are really important. Keeping just being very vigilant, going up and down stairs, and again making sure that the medication that you're on doesn't have any of those side effects. Okay, so if we can go to the next, to the next slide, please. Okay, so let's just go over that. So medications, a risk of falling. Any drug that causes a falling can increase your risk of falling. Again, it's dizziness, drowsiness, dizziness, hypertension, high blood pressure. If you have Parkinson's disease, shaking, poor mobility. If you have a gait disturbance, poor muscle control that causes clumsy, involuntary movement. Vision disturbance, not seeing well, double vision. Again, being very careful that your house isn't cluttered. Any drug that causes the following can increase the risk of serious outcome if an individual falls. For women in particular, and that's why women have more, injuries, osteoporosis, or reduced bone mineral density. So it's really important to get x-rayed and make sure that you're taking the proper vitamins for your bones. Can be an increase of falls. Now, bleeding risk, increased of hemorrhaging if a fall occurs. That means if you're on a blood thinner as well. The next one, please. So let's look at that. Are you at a high risk for fall? So that's something you could look at for yourself. Have you or your loved one had a slip, trip, near fall, or fall in the last 6 months? Now, everyone can have a little bit of an accident, but if you really find yourself like tripping a little bit, or when you're walking and all of a sudden, you're kind of feeling you're off balance, it's time to get looked into. Are you or your loved one taking a drug that doesn't cause side effects such as dizziness? This is what we're talking about. Are you or your loved one taking a high dose of drugs? So if you're on, like, let's say 3 or more different prescriptions a day, you are at a higher risk. So you've got to be really mindful. Are you or your loved one over age 65? For sure, that's one of the things that we're talking about, that the drugs affects because of the change in the way the body absorbs, distributes, or eliminates the drug. Are you taking more than one drug? So that's also a risk factor. Are you or your loved one at high risk of falling from other non-drug reasons? Poor mobility. Now, if you're using a cane or a walker, be particularly careful. Is it difficult for you or your doctor to monitor any of these adverse effects? Does your loved one suffer from any form of dementia? So these are some of the risk factors, and they are all in the guide for you to see. It's just kind of a reminder. Next slide, please. Okay, so pharmacists are your best friend. They are my pharmacist, she's my best friend. Pharmacists play a role as part of the interdisciplinary healthcare team for an older adult. Their role is crucial in improving the patient's care and life. For older adults, it can be helpful to really develop a relationship with the pharmacist and use the same pharmacist regularly. As pharmacists learn about the individual's unique needs and circumstances, they can help provide consistent care and help prevent drug-related problems. Pharmacists are often the most accessible healthcare practitioner. They can give patients drug information, monitor use, and act as liaison between your doctor and the other healthcare workers. They'll give you information about side effects, about what food you should or should not be using. The average adult over 65, this was shocking to me, takes between 14 and 18 different prescription medications each year. Pharmacists can educate older adults on how these medications help them and just to be really cautious about it. Now, it's important to use one pharmacist if possible. I know for some of you it's difficult because I think some people order over the internet. It's very different here in Canada. For whatever reason, even if I go to one pharmacy or the other, they're connected. So once my pharmacist looks into the computer, they can see what medications I've been taking. So the other things that a pharmacist can really help is use a physical accessibility, such as easy bottles or pills without wrappers. Some caregivers tell me that they don't have the physical ability. If you tell the pharmacist, they will accommodate you. The same goes with larger labels. They can print them a little bit larger. And they could even put it, if it's possible, in Spanish and the languages someone can read. Now, some pills are really, really big. Please never, never, never cut the pills yourself, because some pills should not be cut at all. But if they're too large, the pharmacist can definitely cut your pills in a safe way. It's the pharmacist's role to give you the information you need about each of your prescription and how to take them. And again, it's important to use one pharmacy if possible. I think there was something on the chat. Should we have a look?
Dorsey asked a good question. Why can't we cut the pill if we have a pill cutter?
If you have a pill cutter from the pharmacist, and what I would do is I would go to the pharmacy before and show them how I'm doing it. If the pharmacist is perfectly all right, by all means.
Yeah. And what I was thinking, Lucy, is if you're using a knife or something, which you shouldn't do, by the way, but if you're using a knife, you may not get the same dose in each half of the pill, right?
Well,
Yeah.
that's what I was trying to say, yes. It's not
Yeah.
gonna be as effective. So if any of you are still cutting your own pills, stop it, please.
Well, I'm sorry, but my husband, I'm sorry, just to interject.
Go
But they
ahead.
have my husband to take a half dose of one of his medications, and I have to cut the pills because the pharmacist doesn't. And
Hmm.
I've been using the same pharmacist.
He won't cut them for you?
No,
Well, does he have, is he the owner of the pharmacy?
well, it's Walmart pharmacy.
Walmart.
Yes,
It's hard for me to believe that. And I believe you 100%.
yeah,
But I would be very adamant. I would really, really be adamant and insist that these pills be cut.
okay, okay.
Well, don't be, I mean, we can always insist in a very nice way. We don't have to get angry, but you have, you have to,
We can always what?
yeah, you have to advocate for yourself and your husband. They have to cut them for you. It's unacceptable. There's always a manager. There's always someone in charge, even if you have to go there. So thank you for
Thank
asking, though. I'm really glad you asked this question, and I hope that you will be persistent.
I will, thank
Good.
you.
You're welcome.
Thank you,
Okay.
Carolyn.
You're welcome, thank you.
Any other questions before we move forward?
Well, Kim commented that she failed again on that one.
Well, that's why we do these sessions.
Exactly.
You know, I'm not a doctor, I'm not a nurse. I do a lot of research. So when I learn something new, I want to share it with other people. So I'm not here to tell you what medications to take, what not to take, but I'm here to share with you what I had to go through myself with my mother. This is not something new that I've been working on. It's been years. So if I can, if you get one little tip out of this, I'm happy. Okay, so if we can move forward, let's talk. I'm looking at the time. Okay, let's talk about the guide, this wonderful guide that you can all have for free. The way it works is a really interesting guide. I'm not going to go through this. This is just the contents of the guide. I wanted to show you what is in this guide. And so let's go to the next slide, please. Okay, so this is how it works. There's a question and there's always an answer at the back. So, for example, these are just things I pulled out. Is the prescription medicine from more than one pharmacy? Interesting, we were just talking about that. Or another question, does the person have any medicine supplies from the doctor? If you say yes, because it's your guide, here are the answers. So if yes, speak to the pharmacist to see if there's any problem taking all the medicine together. People who use more than one pharmacy have a higher chance of having problems between different medications. And the other one was, if your doctor gives any supplies, talk to the pharmacist before the person tries them to make sure the samples go well with other medicine in the person that the person is taking. I want to tell you, doctors are phenomenal, but doctors don't know about medications as much as pharmacists. So with all due respects to doctor, if a doctor would give me any supply and say, try this out, I wouldn't do it before I would ask my pharmacist. Next slide, please. So this is all from the guide. Okay, now I talked to you about side effects, and most of the side effects I spoke to you about were really dizziness, falls, diarrhea, but there's other side effects that you need to look at, especially if you're a caregiver. Has the person had any changes in their, changes in appearance? Your skin can tell you a lot about what's going on your body. If you all of a sudden get a rash on your tummy or your back, something's going on. It could be the medications. Your complexion can change. You become rosy or very pale. Our eyes tell us a lot about our internal health. Sometimes, the whites can turn a little bit to yellowish. Your nails, if they become brittle all of a sudden, it's not the same, tells you that something's going on. Now, people, as we age, we lose hair, but I'm talking about really clumps of hair. An appetite could change also as a side effect. You're eating too much, you're not eating enough, you feel sick to your stomach. Dry mouth is a huge, big side effect of taking medications. It might not be a harmful side effect, it's not a pleasant one. And someone who's more thirsty, that's a big sign to talk to your doctor about. When we talk about thirsty, again, I'm not a doctor or a nurse, but it could be a sign of something going on diabetic. Behavior, mood changes, things like that. So these are all things that you should keep an eye on. Next, please. Thank you. Has the person had any changes in comfort? So that could be also another side effect. All of a sudden they have any pain that wasn't there before, aches, headaches. Remember, I told you that people who have high cholesterol, some of that medication exhibits itself in actual joint pains. Has the person had any changes in energy? They're more tired, they're more energetic. Has the person had any changes in sleep? They can't stay awake or they cannot fall asleep. And we better go a little bit faster because our time is running out. But remember, if you want to stay on with me after we finish, I'm here. So again, this is how the guide goes. Does the person drink beer, wine, or liquor while taking medicine? I want to go through this one because it is important. If yes, make sure it's okay to have alcohol while taking the medication. It's very rare, but sometimes it's okay. Check the medicine instructions and label and ask the doctor or pharmacist to make sure. If it's not okay, the person will have to stop drinking alcohol or drink less while on medication. Explain, to the person, if possible, that it has bad side effects. And even if you think, I had a glass of wine at my dinner at 6 o'clock, but I don't have to take my medication until 8 o'clock, it might still be a no-no. Okay. Now, I know that some caregivers have a real problem with that because some people are very much addicted to liquor and it's hard for them to stop. But I think it's something that needs to be talked to with the doctor or the pharmacist. I see something is there from Becky.
Becky, I argued with the doctor that with my dad about alcohol. The idea was he was so old, let him have some.
Isn't that a lovely answer, right?
Yeah, really.
And then let him take his liquor and his medication and fall on his face and line up at the emergency room. I don't appreciate such remarks. I know that for some people you figure, okay, they're older. Listen, my mother was diabetic, so I restricted her sweets, but once in a while it's okay to have an ice cream or a cookie or whatever. It's a very personal thing that you have to talk to with the person that you're caring for, if they're cognitively able to. If not, you have a huge responsibility on your hands. It's a problem. It is a problem. So I recognize that. All right, next, please. Yeah, okay. So these are the kind of questions that are on the guide. And if you want the guide, you can have it. I just want to focus on, has the person been in the hospital lately? If you say yes, it's so important that you get a really good discharge planning with all the medications, because they're going to change the medications in the hospital. I can almost guarantee it. So if you have a good discharge plan with all the medications, even if you can call the pharmacist ahead of time, give them a heads up, it's a good idea. Next slide, please. Now, in the guide, it tells you, I'm not going to go through them because of the time. It gives you a nice list of all the questions that you can ask the pharmacist or the doctor before you accept any new prescription. Next slide, please. Here are the references. There's 2 pages of them. You will be receiving them. So if you want to really get into it a little bit more than I did in this session, I would be very glad to, you'll be receiving them. I'm going to pass it over to you, Glenda, because you have 5 minutes.
Oh. Yeah. I want to thank you all for being with us today and appreciate your patience with our technical difficulties. It seems like every time we get on, there's something going on. I think it maybe was the rain here in Texas today. I don't know. I want to tell you a little bit about what's coming up on the Caregiver Teleconnection. On Tuesday, that's this coming Tuesday, May the 16th at 10 o'clock Central Time. If you're caring for someone that has frontotemporal degeneration, FTD, it's a type of dementia. We're going to have a presentation by Sharon Hall, and she's going to be talking about what it is, what it isn't, and what are the signs and symptoms. And so that should be a very informative session. Then the next day on Wednesday, May the 17th at 10 o'clock Central Time, Lucy will be back with you along with Dr. Elliot Montgomery-Sklar, and they're just going to be talking about tips for aging in place. I may tune into that one because I'm trying to do that as best I can. And then I will be back with you with Lucy and Elliot on Thursday, May the 18th, again at 10 o'clock Central Time. We're going to be talking about a really serious issue here, and something that I think we need to talk more openly about is caring for someone with mental health issues. It's such a big problem here in our country. So I'd encourage you to tune in for that. Now, as Lucy kept referring to, the guide will be available to you. If you register for the call, you're going to be receiving a follow-up email. And in that email, it's going to include the information that Lucy shared today. I'm talking about her presentation with all of the resources, and we'll also give you an opportunity to ask for that guide. So that's where you do that, and it will be mailed out to you, and I encourage you to take advantage of that. Let me go back over to the chat. I see that we have some things here. Ms. Henderson, I was told with my mom that at a certain point, it's about them having the way of life, meaning that it's about being more comfortable and happy rather than being unhappy and worrying about damage being done. Is this correct, Lucy?
You know, that's a great question, and I would love to talk a little bit more about it once we get off and close the recording. It's a very individual thing. As I said, with my own mother, I would like to discuss it more. So if you could stay on, I would be more than happy to review that. It's an ethical question. It really is an ethical question. It even borders on abuse. Like, you know, if you can even understand what I'm saying, meaning that you want to keep the person you are around for as long as possible, but what quality of life do they have? So I'll talk more about that.
Definitely a big ethical issue, Lucy.
Yeah.
And Minerva has put in the chat box about if you did not register for the call today, you can call our customer service number, and she gave it again. And you can receive the guide. Also, that you're going to receive a survey asking how we did today. Don't remember the technical difficulties, please. But how the session went for you. Did you learn something there? If you have a topic you'd like to see us cover and you have not seen it on the Caregiver Teleconnection, let us know about that. We'd love to have some new topics. Or if you've seen a presenter somewhere, maybe you have somebody in your community that you think is an outstanding speaker on caregiving issues or issues in aging. Let us know who that person is. We'll reach out to them and see if we can't get them on the Caregiver Teleconnection. Kim, thank you so much for your little comments. You gave me a little smile, even though it's a serious topic. And now you have more information about what to do there, right? So glad about that. Let me see. What is this last one? Oh, that's from Minerva. For those of you that want to change your name in Zoom to remain anonymous during our post-session chat, click on participant at the bottom tab of your screen. Find yourself and click on the 3 dots next to your name, and then you can rename yourself so that it will be anonymous. Well, Lucy, thank you so much for having me with you today.
Thank you.
I've really enjoyed it, and I hope you will stay on with Lucy and have a wonderful conversation. I'm going to leave you at this point, but I certainly do appreciate you being with us, and I hope to see you in future sessions. Thank you so much.
That was a pleasure. So what we're going to do now, and let's have a little bit of